Now this is the knee joint. Type of the joint synovial, variety condyloid variety. Atlas surface lower end of the femur and upper end of the tibia. Lower end of the femur and upper end of the tibia. Suppose this is our lower end of the femur and this is our upper end of the tibia. Upper end of tibia. So here femur is convex shape. Femur is convex shape and tibia is concave atlas surface. So between these two, we will be having gliding movements, mean arthrokinematics. Now arthrokinematics. Here we are having flexion, extension, medial lateral rotation. So to get flexion here we need to do posterior gliding. To get extension here we need anterior gliding. Here, okay. So now we are going to see knee joint mobilization. So for that knee joint mobilization, we know where we use knee joint mobilization after TKR surgery. We need Fakka knee joint mobilization to increase the flexibility, to increase the range. So now first we will see distraction of knee joint. Now we will do distraction force to the knee joint. We have to keep it ankle 90 degree flexion. Then here we have to stabilize the lower end of the femur. Then here we do distraction force to the knee joint. This is the way how we can do distraction force to the knee. Method 2. Second method we will see. You know, sit this side. This side. Second method of giving distraction. Here just we will keep one hand and here another hand. Here we are holding the tibia and fibula. Then we will give downward pressure. Downward. So like this. I can give like this. I can give distraction force to the knee joint. Say again, distraction force to the knee joint. You will see mobilization. First one, first method of mobilization. How we can do? Here, suppose the patient is having knee joint stiffness. Patient is having knee joint stiffness. He can be able to flex his knee up to 30 degree. He can be able to flex his knee up to 30 degree. How to proceed with mobilization? Here come to H. Your knee joint should come here. So now for this case, patient is having only 30 degree flexion. Patient is having only 30 degree flexion. How to give mobilization? Give that mobilization. So here I am keeping like this. Now here patient range is only 30 degree flexion. Only 30 degree flexion. So here I am going to see here with hand I am going to give posterior glide. Posterior glide, anterior glide. Here I am going to do like this. Here anterior glide to the tibia, anterior glide. Now we will see second method of mobilization. Suppose if the patient is having almost 60 to 70 degree flexion, and 60 to 70 degree flexion, then we need further range. So we can do in this position mobilization. We can do in this position. So here we have to stabilize the ankle joint. Then here I am holding the tibia. Then now I can perform anterior glide. Now I can see how nicely tibia is moving here. Anterior glide. Now we will see posterior. Here like this on tibial tuberosity we can do like this. Here also we can like this also we can do. This is the posterior glide. We can apply posterior glide like this. This is second method. Relax. You know. Now we have to go to prone line. Plus. So this one more method to give mobilization. Relax, don't feel right. Relax. So this is one more method to give knee joint mobilization. So here we can take patient knee joint into flexion. Like this we can stabilize. Like this we can stabilize the ankle joint. Here I am holding the tibia. So here I can give anterior glide. Here I can give anterior glide. This hand placement. Otherwise we can keep hand like this and we can give anterior glide to the knee joint. This anterior glide, and posterior glide we can hold like this. Then we will give posterior glide to the tibia. Okay, this one method. Here come to sitting. One more method for knee joint mobilization. Here patient can be in high sitting position. It is like progression. So here patient will be in high sitting position. First we have to give here distraction. First we have to give here distraction. After that we can make patient position like this. Then we are going to give distraction. After that we will give posterior glide. See this posterior glide we can apply like this, and anterior glide say like this we can apply anterior glide. Like this we can apply anterior glide. So this is the movement. In this knee joint mobilization, we have so many methods. Go to supine line. We have so many methods. So we shall now suppose if the patient is having only 10 degree, 20 degree, 30 degree flexion bend, we can do edge at the edge of the bed. We can do either supine, room line mobilization. After that, if patient improves little range, then we can go for 30 to 40 degree flexion. Here we can do mobilization. After this, for progression, we can make patient sit in this high sitting, knee joint will come to 90 degree. Then we can do mobilization. So it's like a progression of the mobilizations. Here